Okay, so my name is Chris Dion, and I'll be the host for today. And I'm going to just set up the agenda and introduce you to the stars of the show, Dr. Stephen Davidowitz and John Brooks. But just a little housekeeping, like I mentioned earlier, we will be sending out a link to the PowerPoint as well as a video replay of this afterwards. That'll probably go out by midday tomorrow. So just give us a little time to prepare that and send it off to you. Also, like I mentioned, there is an offer from both Monmouth and Smile Vision. We'll mention that at the end. Okay, let's hop right into the agenda. First, we'll be introducing the two speakers, which I'll do shortly. We're going to talk about how cosmetic dentistry demand is on the rise. A modern, newer approach to predictable teeth straightening. Dr. Stephen will be talking about that. Clear aligner treatment case studies. Dr. Stephen Davidowitz will be talking about that. Then we'll move on over to cosmetic imaging and template technique, which John Brooks will be talking. And then the two of them have worked together. And they're going to talk about some case studies involving both of this technology or approaches. Then we'll wrap it up with an offer that I think you'll all love and Q&A. So as regarding questions, as you have questions, what we would like you to do, just go ahead and either put it in the Q&A in the button or in chat. So we won't be answering the questions as we move along, but ask the questions as you come up with them. And at the tail end of the webinar, we'll answer those questions. Okay, now let me introduce you to the stars. Dr. Stephen Davidowitz. He is a doctor of dental surgery, got his degree from NYU College of Dentistry. He did his general dentistry residency at the Brooklyn Hospital Medical Center. He has a private practice called The Luxury Dentistry in New York City. He is also the co-founder of Monmouth, what he's going to be talking about today. He's also the chief dental officer at Monmouth. Not only that, just because that's not enough work for him, he is the author of a few books, and he's the host of a TV show called Your Best Self. It's on WLNY CBS. Then we also have John Brooks. John is a certified dental technician with over 30 years, specializing in the Crown and Bridge area. He's a graduate of the MDT program at the NYU School of Dental Medicine. He's the owner of Smile Vision Laboratory. He's also, this is really interesting, the co-developer of the template technique, overtemp technique, and the Goldstein direct bonding technique. He's a key opinion leader and certified CEREC and in-lab trainer. So you got some real good brains here that I think will help shed some light on the whole cosmetic dentistry market. With that, I'm going to go ahead and hand this over to Dr. Stephen Davidowitz.
Thank you so much, Chris. That was a great introduction. And hello, everybody. Thank you so much for taking the time out of your day to come and listen and learn. So here's what I want to start with. The demand for cosmetic dental treatment, it's on the rise. And I'm sure you're seeing it in your practices. It's seen in every industry as far as financially, anyone wants to invest in things. They're like, dentistry is where you want to place your bet. And you want to do that with cosmetic. So this is just showing you a graph of just how much of an expected increase that we're going to be seeing, not just right now, but over the next decade. So what can we do? Basically, if you think about it, what are the top 3 requested cosmetic enhancements that you're seeing right now? As we're coming out of the pandemic, we're seeing a tremendous increase. And I'm sure you are too. We actually have intake forms for new patients. We ask them to rate their smile. I think it's a great idea. You lead the patient to have their want and you give them the solution. So we ask them, rate your smile 1 to 10. And then we say, what are the top 3 things that you would do to make your smile better? Number 1, whitening. Teeth whitening always comes up number 1. Number 2, teeth straightening. Number three, it has to do with either uneven, discolored teeth, chipped teeth. What could I do? I've tried bonding. I've tried all these things. What could I do? Those are the top three things I have here. It's also the top three things that we have from all of our dentists that are using ModMouth, and we've asked them surveys. So it's not just here in New York City, it's across the country. So, okay, those are the top three. Whitening, I'm pretty sure most people have some sort of whitening. So keep at it. Use it. It's a low-level cosmetic enhancement. Patients love it. It does a good job. But how could you address the other two in today's market when it's at such a rise of demand? So let's talk about teeth straightening. There are one main player maybe with clear aligners. So that's for both adults, teenagers, even a little bit younger, not going the path of braces. So it's right, they want something cosmetic. They don't want something that's metal and is stuck onto their teeth. So that led me to the want to have more than just one big player. And that's going to be clear aligners to straighten teeth. Whatever you want to use for the clear aligners, great for a general dentist to straighten teeth with clear aligners because it's cosmetic. It's done pre-op, so you're not doing it in the room. You have all the trays and everything you need before you go. And it is very profitable, and it can lead to bigger cases, bigger cosmetic cases. How do you introduce that? If somebody is on this meeting and that you've not done clear aligners, or you only do a little bit of clear aligners, or for those that do a lot of clear aligners, you're probably doing this already. But it comes down to your hygienists. They're like the emotional connection between a patient and the hygienist is amazing. They're not really typically very nervous when they're sitting in their chair. They like to talk about their family and where they've been and big events coming up. So they have that relationship. And what I found to introduce clear aligners is that typically it's like three quarters of the patients. If you look at your day, open up your Dentrix or whatever scheduling appointments that you have right now, and you look at your hygiene patients, 3/4 of them have some sort of crowding, spacing, some malalignment. It could be relapse from when they had braces when they were a kid and they just didn't wear the retainer. It's just the magnitude and the numbers are crazy of how many of your existing patients, not finding new ones, your existing patients could benefit from clear aligners. So our hygienists usually will point out a problem, right? Whether it's, do you find it hard to clean between these crowded teeth? I noticed that there's constant gingivitis and bleeding right in the areas where your teeth are overlapped. Have you noticed that? And the patients will say, yes, I do everything. I'm flossing, I'm brushing, whether they're telling the truth or not. And she says, well, I'm going to have Dr. D come in, and he's probably going to mention something about straightening these teeth. And there's the solution. So the patient is appreciating the problem. They're looking for a solution. And it's not just come in more frequently for recalls. It's not just floss better. You could actually do something for them. And the acceptance on those patients is through the roof. Second thing is utilizing modern technology like smile simulations. Smile simulations come in two ways. So with clear aligners and with ModMouth clear aligners, you're able to send a patient a before and after, and actually each aligner, how everything's going to look all the way through. And it's so powerful for a patient to see the outcome and how it actually works. Smile simulations for other cosmetic procedures like veneers, crowns, rehabilitations. When patients are able to physically appreciate, how could you physically appreciate if you haven't done it yet? It's actually not physical, it's more emotional. So if you could simulate an outcome before you do anything, the patient will continuously look at that picture, and most over a period of time is going to sign up for those bigger cases. And we're going to talk about both of these things, clear aligners as well as smile simulations. So going back to the clear aligners, as Chris mentioned, I am the co-founder of a clear aligner company. It's called ModMouth. And what's really cool about ModMouth is that the two founders are general dentists. And the whole purpose of this was created back in 2017, pre-pandemic, whoever could remember those years. And the whole purpose of ModMouth was, I guess, a little bit of a frustration of what we dealt with, a lot of knowledge of what we had about plastics and moving teeth, and how could we help our colleagues, our general dentists, use this and really profit by introducing clear aligners in their practice. So the founders are myself and Dr. Gary Davidowitz. You might notice the last name is quite similar. And that's because Gary Davidowitz is my father. So decades of experience, if I just explain that quickly, I don't want to bore anyone on the meeting, but decades is decades. Dr. Gary Davidowitz was actually teaching plastics and moving teeth about 20 years before Invisalign was even a thing, right? It wasn't a company yet. So he was going around the country actually showing how you could move teeth with plastic. And he did that, it wasn't with technology, it was all analog, but everything was poured up models, plastics were sucked down, pressure points replaced with something called Hillard pliers. And I got this experience, it was actually my first job, just at 12 years old, working in his office in the basement, making the models, sucking down the plastic, heating up these pliers. So like we know plastics. Obviously with technology and everything in the modern world, we advanced with it. So on the next slide here, it's what I'm so appreciative of, is that our mission was accomplished. We did it. We created a clear aligner product and solution that is really for dentists by dentists. So what does that mean? We want to increase the predictability of our treatment. We want an alternative clear aligner for our dentists, and we want to offer it at the most affordable price on the market so that you could sell this to more people who want it to be affordable to the dentist so that more people are clients. That's Monmouth. So just a little bit about the product itself of Monmouth. It is a complete solution. So it's not just you treatment plan, we'll make the product. We're treatment planning, we're there for you. And we'll get into that a little bit later of what that means. But it does start with the plastic. And again, we know plastics, but even though we know plastics, we went through every plastic on the market. We created some plastics on our own. And what we were looking for was a plastic that's going to provide a firm but gentle force, but continuously over the course of the week or 2 weeks to the teeth. It has to be super comfortable to wear. It has to be, if somebody was using a different plastic and then they're given our plastic, they're going to say, this one feels better. It feels more comfortable. It's easy to put on. It's easy to take off. I'm able to talk. I'm able to function. It has to be able to stay clear during the full course of the treatment. And what we ended up with was having something called Zendura Flex. And this is the Monmouth version of Zendura Flex, which has that. It has this tri-layer. So on the outer two layers, you have a harder layer. So that's going to be that continuous plasticity of force. And then inside, you're gonna have the elastic, which is going to make it more comfortable. It's also gonna get a lot more pressure points on that tooth so that we have the predictability. And just this is just our logo, but what's beautiful is the presentation of the box. It looks great. A lot of the doctors that have signed up over the past few years have actually given this box to their patients. So they take out the aligners they need to keep in their office. It's just the presentations there. It also has the chewies. Chewies are little things you're able to bite into, or the patient can bite into in order to help engage the aligners. For those that are new at this, for those that have been doing this, you're familiar with chewies. It has an instruction booklet, all the aligners needed, as well as obviously a case for the aligners. So the whole purpose of for dentists by dentists was, I don't have time for things many times, or to read things and to go through complicated steps in order to become a provider of something. We kept it simple. So it's really 3 simple steps to introduce this to your office and be able to submit a first case of clear aligners for some that haven't done it before, or to try something new. And it starts with provider registration, which is a basic form where you just give your address, phone number, your name, obviously, and some other questions, not too many. And once you submit that There's a verification process. It takes typically about 12 hours to 24 hours, and then you are able to access our Monmouth Doctor Portal. At the Monmouth Doctor Portal, that's where you submit all your cases. We've simplified this tremendously versus really anything else out there. Again, I understand time is so important to a dentist. We just don't have time. And then you manage the treatment through the portal. It's a beautiful portal. And let's go through some of these steps for you. All right, so this is the portal, just a basic overview of it. If we go to the next slide, we're going to see where you enter the patient information, right? So once you are a provider, you'll be able to submit your first case. You put your patient's name, last name, and basic information. Photos you're going to be putting in. And if you would like, it is helpful. It's not required. You could put either a PAN or an FMX and a CEF if you have that as well. In the next slide, we're going to show that we are at this point only accepting digital impressions. However, if you are looking into getting digital impressions, but right now you're just taking traditional PVS impressions, please reach out to us, reach out to our concierge and team, and we do have a solution for you. And then if you look at the prescription, it's one tab. So it's really putting in the chief complaint, anything additional that we need to know, which teeth need not to be moved, and are you just doing upper, just doing lower, doing both? And then we have an option of a 1 to 2 week cycle. That's basically it that you would need to do as a beginner. For those dentists that have been doing this for a while and they want to be a little more hands-on, you do have an ability to go into a more detailed prescription. And then you're going to get like a summary of that, and then you submit your case. And what you're going to get back within about 12 hours to 24 is a 3D representation of each individual movement and step of treatment. You can open the mouth, close the mouth. It's a beautiful 3D representation. There's other functions here. For those that have been doing this, it might look somewhat familiar, or if not better. And for those that are new, they're going to love this. This is also where you're able to share this with a patient. So if somebody's in a hygiene room and it's just an idea of, hey, this is the solution for you, and they're like, oh, I have to think about it, you are now able to follow that up and send them a video of step-by-step of showing how great everything's going to look and how it's going to actually occur. And just going with the concept, of for dentists by dentists. And this is a great example. And our dentists that have signed up over the past few years, we collect data from them and they love this. And it's kind of mind boggling how this wasn't presented before or delivered to dentists, was the Monmouth simplified IPR. And basically it is increments of IPR instead of all at once. So what we're doing is when we're making space, right, there's going to be 3 key principles to move teeth. You need a force, you need time, but you need space, because you can push something up against the wall, it's not going to move. You need space between it for it to move. So if we can't expand enough where we're going to need some more movement, we're going to need to create space. And that's what interproximal reduction is for the newbies on the call. And we traditionally do this 2 ways. One of them is with files, which are hand files. It's the most simplest way in an extent. And then there's rotary. Rotary is using our hand pieces, which I've always found to be intimidating and very dangerous in a way. Things going crazy. And for those who have patients that are closing their mouth or putting their tongue where it shouldn't be, and I'm sure all of you do, it's scary to me. So I was always a fan of hand files, but when IPR is not split up in a simplified form, you could be sitting there literally for about 45 minutes, going from file to file to file. The patient, you could see their eyes getting more and more worried as you're going through each file, thinking, do I have any tooth left? So the simplified IPR that Monmouth created is IPR increments in only 0.1 to 0.15 millimeter increments. That means per step, it will never be above that. So that procedure, it gives convenience for both the dentist and the patient. The patient's not going to think that they have no tooth structure left, and the dentist's hand's not going to feel like it's going to fall off. It also allows the office and the dentist to only stock the IPR instruments needed, which are two of these files, right? For that visit, you only need these 2 files. They are autoclavable depending on where you're buying them from. And if you need help of where to buy them from and which ones we found to be the best, speak to a Monmouth concierge. Pricing. This is the most exciting part for me, because you have to price things in your office to make money and to pay the staff and all the inventory. It has to make sense. But what I found is that when I was presenting clear aligners and then the price tag came, patients would say, I can't afford it, or I don't want to finance through a third-party company, or I have to speak to my spouse. Every excuse in the sun to get out of the door because it was too high. But what if we could lower the cost to the dentist? And maybe the dentist applies that to the patient. And now you have an option that you could present that is as good as, if not better than others on the market, but at a discount. So our price is $9.99. And I love the retail price there. As a dentist, I laughed at it. I was like, just make it $1,000, but it's $9.99. And it's the most affordable clear aligner alternative on the market, period. It really is. I'll explain that on a future slide, but it includes everything from the entire case, everything you need for the treatment planning to all the aligners, attachment templates, the instruction booklet, the chewies. It's all included in the $9.99 plus 1 refinement. For those newbies on here in clear aligners, that a refinement is when you go through all of the aligners and the teeth should be straight at that point, but there's still more to do because things didn't maybe track 100%. So it includes that first refinement. So you get all the aligners that should get the teeth straight plus 1 refinement. If a case needs a second refinement, it's really just to cover basic costs. It's just $149. If it needs a third refinement, there is another $149. If it needs a 4th refinement, we actually don't charge for that. And the reason being is that our dental team, we're founded and owned by dentists, and our concierges who have all experience in dental offices are going to figure this out. And we're going to help. We're going to help figure out what happened here. And it might be as simple as the patient was not compliant or something happened in their life, or it might be that case selection or not tracking or IPR not being done according to schedule. We'll figure it out and help you. And we're not even going to charge you because we don't anticipate you getting anywhere close to even a 3rd, let alone a 4th refinement. So if I can, and by the way, as Chris mentioned, any questions that you have, please put it into the chat box. We're not going to be addressing them right now, but we do have time at the end so we can answer any questions. But I would like to go through some case studies of using my product, the Monmouth clear aligner system. So my first case study, this is Stephanie. Stephanie came to me. I was a 3rd consult, right? So it's a 3rd opinion. And she went to an orthodontist. Then she went to a general dentist, and then she came to me. And the first 2 consults that she had recommended to address her chief complaint, which was upper and lower spacing, pretty evident in the photo. And both of them suggested Invisalign. And the fees between the orthodontist, the general dentist, there was a discrepancy there. It did go down when it went to the general dentist, but it was out of her budget. And she was coming to see me to see what I had suggestions with, maybe a bonding or any other alternative. And I said, no, well, bonding, I don't really think is great for you because you would have these big blocks of teeth. You don't really have much of a tooth size discrepancy, but I do have an alternative to Invisalign. And I mentioned Monmouth, and what is that? It's aligning your teeth with a great product. It's just that the price point that I'm charged for it is lower, so I'm able to offer it at a lower price. So if we go through our case, what we do on a first visit and on a consult is that I always take photos. Even if it doesn't seem like it's going to turn into anything, It takes me like 3 minutes. You could also address your staff or train them how to take these photos, because a photo, and John's going to talk about this a little bit later, and I mentioned it a little earlier, photos are an emotional connection. And when you take these and show it to them on the camera or put it up on a screen, it's like blowing up their concern. So not only do they have a concern, now you're like, hello, right? It's like, let's take care of this now. So these are our intraoral and extraoral smile. And you could see that, her tooth size, it's okay. I mean, the centrals are a little slender, but we could close this pretty easily using mouth clear aligners, and it really in a predictable way and super quick. So if we go on to the next slide, there she is. That's Stephanie, 4 months later, 0 refinements. This is a slam dunk case. I mean, if you see somebody that has just a little flaring and they're spacing and you haven't done clear aligners before, grab them, take a scan, take some photos, send it in. I mean, that's a slam dunk case. Again, 0 refinements, she was done. But the next photos, we'll have some more photos of her intraorally. You'll see on that slide. Chris, if you go forward 1. There you are. So that's a close-up and occlusion, great midline. You could see that the 8 and 9 looked like there were maybe a little bit of a tooth size discrepancy. It looks perfect in her frame, both retracted and in her smile. I did put on the lowers a fixed retainer. I do like removable retainers better because it's more hygienic, obviously, and less maintenance. But in a spacing case, I tried to get wires on, at least initially. On the uppers, there was no room for that. So she is also, in addition to the wire on the lower, wearing mouth removable retainers every night. If you look at her smile, by the way, and I'm going to point this out in the other as well, look how confident she looks when she's smiling. And if you go back a few slides, Chris, to her before, you're going to notice that her head's like a little crooked and just not comfortable. It's like, oh, get that camera away from me. And months later, like literally, she's just like, yeah, take a picture. Love it. Love it. And she referred to me another 5 patients. This is a third opinion patient. She didn't know me. She found me on Google. She already tried 2 other people she obviously thought of higher than me because she went there first, came to me and ended up referring us 5 more patients because she was blown away that there was an alternative that nobody knows about. All right, so second case study before I hand this over to John to say how he works his magic. This is Daniel. Daniel was a patient for like a year and a half before we started him up on Mouth. And it was the hygienist, really. It goes back to one of the original slides. He had gingivitis and recession occurring on the lower anteriors. And we tried putting on a more frequent recall. I probably mentioned, teeth straightening, but it went right over his head. But he started to form a relationship with my hygienist in the office appropriately, totally. But he wanted to do better for the hygienist. And he said that he's still finding bleeding and it's still there. So, have you noticed by the crowded areas that you're having the hardest time keeping clean, that it's bleeding? He said, yes. She said, you should really talk to Dr. D and talk about straighten your teeth. And he said, yeah, I think he mentioned it in the past, but now he really wanted to please the hygienist because he wants to do better. He wants to have good oral hygiene and to come to a visit and be told everything looks good. So he had moderate upper and lower crowding, constricted arches. You're going to appreciate that when we look at the intraoral photos. He also had an anterior crossbite as well as a unilateral, just one tooth posterior crossbite. So let's take a look. We always take our photos. Take your photos. It's so worth it because then you have them. Once you have the photo, you can just submit it for a clear aligner case. If not, you have to have the patient come back. So you already have them. They don't have to come back. When they come back, they're starting treatment. So these are the photos we took on that same day. And you can look at the upper arch. I mean, it's a V shape. That's a true V-shaped arch. You can see the second bicuspid on the upper is, that's a rotated tooth to the point where I, as a general dentist, would not want to rotate that back. Why deal with a space posterior to it and have to deal with other problems? Right now, it has good contacts. But anyways, that's the V-shaped arc lower. You could see the crowding, and then you can see the crossbite that's occurring between the canine and the lateral. And if we go to the next slide. Look at him. 7 months later. This one, we did need one refinement. Again, one refinement is included with mod mouth aligners, because in a case like this, anticipate that you're probably going to need a refinement, because everything looks great, but the crossbite's still a little tight. You still need a little bit of movement or whatever it may be. But again, Chris, if you could just toggle back to where he started from. Sorry, there. I mean, he didn't want to smile. He looks like he's in his mid-30s. He looks like he was like just getting through puberty, right? He like kind of timid. When I finished this case, he was standing there. If you go to that photo, he was standing there, and he looked like he was ready to take on the world. Yes, it's profitable, extraordinarily profitable to introduce clear aligners in your practice. 3/4 of your hygiene patients alone could benefit from it. But the appreciation I get in just 7 months or 4 months, when somebody's life is changed, and it was such a simple treatment on my end, is so rewarding. Anyways, let's go to the next slide. The next slide is going to be me introducing. Oh, that's it. Okay, sorry. So this is a U-shaped arch. No longer is it a V-shaped arch. The crossbite is gone. Let me point out one thing before I bring on John. Look at the retracted view, of the lower anteriors, and look at the gingival levels there. And if you go back, Chris, to the previous intraoral photos, and this is what the hygienist was pointing out. Look at the edema, the redness, right? And look at 24. 24 started a recessive pattern. The gingiva was so thin. He was going to end up with a nice amount of recession on that tooth. And if you look at the end, when he has a nice round arch and everything's put into place, and this is taken right after treatment, so this is not like years later, the gingival margins straight across are even. We literally, and was there grafting? No. Was there any medicaments placed in there? No. We gave him the ability that a toothbrush and floss could actually access these areas, and the mouth responded and the body responded. It's remarkable. Now I would like to pass it on to John.
Hi, everyone. So I'm going to take over from Dr. Steven. He and I have worked together many years. And I'm going to talk about presenting, planning, and delivering multidisciplinary dentistry utilizing smile simulations. Let's get started with it real quick. My father, Larry, started the company in the early 80s. He is a dentist who decided to open a commercial dental lab. In the mid 80s, he started doing porcelain veneers, and started realizing, cases that look beautiful in the lab on the models didn't always go well in the mouth. And that led him on to introducing the Smile Vision imaging service for dentists, where dentists would send us photos and he'd present a before and after to present to the patient to show them what could be done. So between the two of us, we have decades of experience in creating smiles. Okay, so a little bit about me, and Dr. Steven just went through this. I've been at the lab bench now for a little over 30 years, and I'm an MDT graduate from the NYU School of Dental Medicine. I'm also the owner of Smile Vision Laboratory, and you can just keep going right through these. The co-developer of a number of processes. One's called the template technique, one's called the overtemp technique, and the Goldstein direct bonding technique, which have been around probably for close to 15 to 20 years at this point. And they're all really, really effective, and I'll be talking about that in my presentation. Okay. So go ahead and I'm also a key opinion leader for Dentsply Sirona and a certified CEREC in-lab trainer and CEREC and in-lab trainer. So aesthetics are not a thing. They're an emotion. Okay. And how are emotions best communicated? Okay. There are a number of ways of communicating that, communicating emotions verbally or in writing, or in visually through video or photos. Okay, but the old additive of a picture is worth 1,000 words is really the case here. When trying to communicate emotion to a third party. Okay. So smile imaging answers the emotional question, how will I look? Okay. This is a pool in our town. A few years ago, they needed to redo it. And so there are, 30,000 residents in my town, just outside of Boston. There are thousands of townspeople. There are hundreds of tradesmen that are going to do the job. We all are working towards we all are, with these renderings, we're heading towards a common goal. This is what the taxpayers want, and this is what the townspeople want, and this is what we're trying to achieve. So this is during construction. And of course, the construction project's done. The pool's been open for a couple of years, but this process is not unique. This is how large scale projects are done in construction. And there's no reason why we can't take some of these elements and apply them towards the cases that we're working on here. Go ahead. So you want to show the patient what might be possible. You can just keep going through the, Chris. So the smile simulations allow the patient to get an idea of what a possible aesthetic outcome might be. We're not talking about the how, we're talking about the what if in these pictures. When the patient says, that's what I want, then it's up to the dentist and the lab technician using ModMouth's product, using Smile Vision to help achieve that result, those results. In the laboratory, we use simulations as a guide for our diagnostic wax-ups. We actually measure shapes and contours and dimensions of teeth when we're doing our diagnostic wax-up phase. Go ahead. So I'm going to show you now a few simulations. We received these photos online with written instructions from the dentist requesting us to show how the patient will look. And specifically, I have 3 cases here I'm going to show you. Specifically, you can show multiple options here. The nice thing is patients like options. And you can present, we recommend no more than 3 options, but it's a really nice way to show options. So start from the beginning, Chris, and just show option 1, which would be just ortho on 7 and 12. Go ahead. Go ahead. 1. Okay. And then the next option would be if the patient had veneers done. Okay. So I think that this is pretty straightforward, a straightforward presentation, and I think it's achievable. Go ahead and advance to the next one. Okay. Now, this patient may be complaining about their central and lateral being rotated, so the dentist may request us to show that. So go ahead and advance 1. Okay. And just watch teeth 7 and 8. And then an additional option might be to show the patient with a complete smile. Okay. Now, these photos are very emotional, and what I think, so my philosophy here in the lab, and I think it's dangerous when you hear technicians talking about aesthetics in the laboratory. I would call them more micro aesthetics, but facial aesthetics. A lot of times the laboratory technicians don't know the patient, never have met the patient, and don't know what to do. In this particular case, and I'll talk about that more in a minute, in this case, the first option is just closing the diastema with ModMouth trays. Okay, the second option may involve veneering 7 and 10, or possibly bonding or possibly veneers. And the third option in this case is showing the front 10 teeth. You can go ahead and advance one more. And okay, and this may involve tissue recontouring and things that a lab technician can't see just looking at a model. So go ahead to the next one. Okay, so when I'm talking about laboratory procedures, digital tools or analog tools in the laboratory, it doesn't matter. It's the same outcome with using different mediums. I think the underlying philosophies are exactly the same. And just go back for a sec. Okay, yeah, that's good. Here's where the rubber meets the road, so to speak. Here's a technician doing a diagnostic wax up. Now they could be looking at a computer screen as well and trying to design the teeth. We have a very limited view of what's here. There may be some writing, make them look ideal, golden proportions, things like that. But that's limited in my book. So go ahead and advance to the next slide. In our laboratory, we do a smile simulation, and then we actually measure the before photo and go on to the next one. Chris, yeah. And then we measure the same tooth as an after. We're able to come up with ratios to determine that tooth number 8 has been lengthened in the imaging by 1 millimeter. Okay, go ahead and advance. Okay, also the technician, when they're waxing, whether it's digitally or analog, they actually have the patient's face. And we recommend full face. Just showing teeth really doesn't show us any of the facial symmetry. And the photos with just teeth aren't motivating, aren't emotional enough to patients, is from our experience. Okay. So in this particular case, we started with a pre-op model, and you can advance to the next slide. And we ended up here, based on what the imaging showed for this patient. Okay. So go ahead. Yeah. Okay. From that diagnostic wax up, we make a preparation guide. And so you can put an outline over your preparations to visualize that that preps are ideally centered and ideally reduced, so that the lab can do a great job. Now, we know where we're headed with this case. The patient approved the imaging. We waxed the case based on what the imaging shows. And now the dentist needs to prepare the teeth to be able to achieve that. Okay. So this is our template, and this is used for making immediate temporary restorations in the mouth. Basically, it's a hard, soft, it's a double suck down, hard, soft layer. Think of it as a metal impression tray with removable impression material. So you load that up with bisacryl or acrylic and squish it in the mouth. You can go ahead and advance and let it set. That hard outer shell doesn't flex, so the material doesn't distort. And so you end up with a very accurate replication of what the diagnostic wax-up showed as temps. There's also very little cleanup in this, just a little bit of, usually a little bit of film up at the gingival areas that needs to be cleaned up. The hard shell comes off first, and then you tease off that soft liner. So if it were all one piece, you would never be able to remove that matrix the way it is, but having a hard soft that separate allows you to utilize it. So it's very accurate. I saw a patient yesterday in my laboratory, and it was just amazing. It's life-changing. So I'm going to show you now a case in the computer. This is an upper lower, a full mouth case, and you can advance now. Chris, go ahead and advance again. Okay, so we superimpose the model of approved provisionals over the model of the preps. And just go to the next screen. And this is really the shot that I want to show. And this is really where ModMouth really can, if you're planning a multidisciplinary case, it's using ModMouth to put the teeth where they need to be prior to prepping them. In other words, if teeth are splayed out distally and you want to have nice mesial inclinations to your teeth, it's going to be very challenging in the laboratory to try and achieve that. But this to me is like the perfect case where each prep is lined up perfectly within the outline of the desired result of the temps that the patient's living and functioning with. So this is like my dream in my lab. These are the kinds of cases I love doing. Go ahead and advance. Yeah. Okay. And then we're copying the wax up and go ahead, one more. One more. So the goal here is to keep everyone in line with where we're headed. I don't want one technician in my team to take the case somewhere that it doesn't belong. We all know the patients living with these temps, they love their temps. Our goal now is to design the final restorations so they fit within the contours of what the patient's functioning with. Go ahead and advance. Yeah. And one more time. Okay. So this was these were zirconia restorations that this is pre-sinter going in the oven, and in advance. And that's what they look like after an 8-hour sintering in our lab. And here's how they look on the model. Now, I know that right now that these teeth are exactly where they need to be. Now, we may go in and we may do some fine characterization. We may modify a few little items when it comes to shade or texture, surface texture, little things. But I don't want to deviate from the plan that that is the imaging and the temps and now the final restorations. Okay, it's lower. Keep going. Staining glaze. Okay, and glazed up, and that's what we end up with. Now, my experience in the laboratory is we don't know what the patient wants. We are relying on you, the dentist, Dr. Steven, to tell us that the temps look great. If the temps look great, our goal, it's not always 1,000% copy 1,000%, but it's very close to where we need to be. Where we run into issues in our big cases is when we start to deviate from the plan along the way. And I can't tell you how frustrating that is, both for me and potentially for the laboratory, for the dentist receiving the case and the patient, because that's not what they ordered, so to speak. Okay, go ahead. And keep going. Okay. So that's it. That's my part. And any questions you have about this process, I'm happy to answer them if you guys want to write comments. And I'm available to speak to any of you. So thank you. And now I'm going to turn it back to Dr. Steven. And
thank you, John.
He's going to
Yeah, John, that was great. I have to say to everyone listening, right before this webinar, I just sent a case to John. I just did a veneer case, sent it over to him. And the only reason why I had the confidence that I could make it to this webinar is because of that template technique and everything coming from that smile simulation. I knew that I would just make it. It would be fine. And sure enough, it was. All right, so let's just go quickly in the sake of time. I know this is, we're approaching almost the hour mark, and we wanted this to be just under an hour. So let's look at case study number 3. This is, again, a collaboration between Monmouth clear aligners and using Smile Vision laboratory to get predictable results. So this is Regina. Regina presented for a veneer consult. She actually mentioned the word lumineers. She wanted to have a non-invasive kind of veneers to fix her problems. She was unhappy with the shape and color of teeth number 7 through 10, just those 4 teeth. And she had this discolored composite veneer on number 10. It's a dead tooth, and they tried to hide the discoloration, plus to make it look more cosmetically pleasing, but she was never happy with it, and I wasn't happy with it either. So we did our photos. Super important. So we go to the next slide. We're going to see her photos. So this is on that first visit. If on a profile, you see the teeth are proclined, they're also rotated. You could see in the intraoral occlusals, there's crowding that's going on. Luminaires, I don't do luminaires personally. I believe in minimally invasive dentistry. Preparation, though, is super important to get good results. Either way, we had to straighten her teeth first, and I wasn't going to send her out to an orthodontist for a case like this. This is something you could do at a general dentistry office using something like Monmouth. So if we advance to the next slide, we're going to see Regina at the end. This is after we've straightened her teeth. She has a wider smile, less buccal corridor, dark space. Everything is aligned really nicely. Now it's time to get John and Smile Vision and to showcase what we could do for you from this point forward. Again, she asked for 4 teeth. So if you go back one slide, this is following clear aligners. Next slide. What she wanted is going to be 4 teeth. So if you go one slide forward, and then we said, you know what? Let's do one more. Let's do 6 through 11. And if you toggle back and forth there, Chris, between the 2 options, and I'm showing this to the patient, she noticed, hey, my teeth look brighter and fuller when I have 2 more veneers. And I said, yes, I wanted to show you what you wanted, the 4 teeth, but we're limited. It's the incisors. We can't make them brighter than the rest of your smile. But as you get closer to that buccal corridor, you could actually brighten your teeth. And the moment she saw this, the emotions were like, oh, yeah, let's do 6 through 11. So we ended up doing that. We ended up prepping the teeth in perfect alignment following Monmouth aligners. If you go to the next slide, we got a wax up based off of the simulation. Just as John was explaining, everything is measured out exactly based off of the facial imaging. We also have the inclinations and everything perfect, and that's the wax up for Regina, 6 through 11. And this is after the temps. I mean, she was ecstatic. She was like, I'm done. I'm like, no, you're not done. These things can't last more than a few weeks. You have to come back for the final. We go on to the next slide. And we have the actual after. There she is, smiling. Now, this all took 7 months, straightening her teeth, getting the derotations with Monmouth clear aligners. There were actually 0 refinements needed. In case when you're working to have a secondary cosmetic procedure, you don't need perfection. I probably would have done a refinement on her, probably just 1. But I needed it close enough that I could do something that's minimally invasive. And that took about 5.5 to 6 months. And then we did the preparations and had the veneers placed. Smile Vision simulation, we used a template technique so that her provisionals, her temporaries, she felt were the same in her mouth as the final outcome. John, in this case, great communication with the lab. We used Emax veneers based on the coloration and for other reasons, number 6 through 11. And here's her after full face, and then we get a little closer. You see the color is gorgeous. She's looking great. You could see from the occlusal views how we expanded the arch, and everything's in a much healthier position. All right, let's do one more case, and then we can get to the Q&A. So this is Chinita. Chinita came in. It was a cosmetic consult. She had 2 main things. She went through braces actually as an adult, and she didn't wear a retainer. And she said that it seems like everything's like leaning inward, and it's like affecting her whole face, like her skin and everything is going inward. She was also unhappy, always unhappy with the color of her smile. And her upper teeth, when she likes to smile big, she tried whitening. She's done everything. It just, I don't know, maybe it looks like there's some striations, maybe there's some fluorosis or something going on here. And she also mentioned that she wants a wider smile, again, because she feels like her whole face is caving in. And I said, I got the solution. We could address both. We could do clear aligners and we could do veneers. And the thing is, in the past, when I would mention that, and then I would give the price, it makes a difference if you could lower the price by a few $100s or whatever it may be, but I couldn't because I was pigeonholed. But with using mouth clear aligners along with Smile Vision, I was able to address this. Now, if you look at her smile, you can see exactly what she's saying. The teeth are caving in. You see the bicuspids, canines, everything's kind of caving in there. If you look at the occlusal views, you can see the constriction and the crowding. If you go on to the next slide, this is where she finished. Amazing. She has a wider smile. Everything is positioned perfectly. Now let's address the fluorosis or whatever it is that is not allowing her to whiten her teeth. So we simulated her veneers. In her case, 8 veneers. Let's make them whiter. She actually had nice definition. She's an aggressive person. She's a runner. She's a biker. So we gave her a little bit more of an aggressive look. We spoke about it and we were able to show it to her. So she understood what that meant. She's literally looking at herself like, this is what I could look like. I'm like, yeah, not only can you look like it, you'll look pretty much exactly like this. So if you go to the next slide, John and his team waxed it up perfectly according to the simulation and everything that she was ready for. And then we had her in. This whole treatment took 6 months. That's straightening the teeth and transforming her smile. 0 refinements. Again, when you're working together with a comprehensive cosmetic case, get the teeth straighter. It's going to be like 99% there. You don't need to necessarily go further because you're going to perfect it anyways. I use Smile Vision simulations to both show and to follow so that I know my end game. And I use the template technique so that the provisionals look exactly like the final. And here she is smiling. She did not stop smiling. Every 6 months I get to see her and she comes in beaming during the pandemic with a mask on, but I got to see her in the room anyways when I said, take off your mask. All right, Chris, back to you.
All right, thank you. Thank you, Dr. Stephen, and thank you, John. So we got just a couple of minutes and we'll wrap up. First of all, Monmouth. Monmouth operation is run by dentists for dentists, so they understand just how busy you are and the importance that you place on your patients. Therefore, the guarantee that they offer for the product is 100%. That means if you have any problems, they will solve it, refund it, fix it, whatever it takes. You're not going to have any problems, but if you do, they will take care of it. You just reach out to their concierge and they'll take care of it for you. Okay. Also, I mentioned there's a limited time offer. We've had over 590 people register for this webinar. We cannot offer this this great offer to everybody. So we have a limited number of people we can offer it to, but that is the first Monmouth clear aligner case is free for qualified dentists, and the first 2 Smile Vision simulations are free. So please place in chat. When you chat, you can say that it goes to the panelists. Put your name, your email address, and your phone number in the chat to the panelists if you can. And if you do that, we'll put both of these aside for you. I'll also put in chat here in a second a link to speak with a salesperson or a person that can help you. We are at the top of the hour, so I think we're out of time for questions. But I do have questions in chat. I'm going to reach out to these individuals directly afterwards. We'll email you and we can email you answers to each and every one of your questions if you don't mind. We're at the top of the hour. I want to respect everybody's time. So thank you very much for joining, and we will hope to speak with you at another point in time. Thank you very much.